So I grew up in St. Louis, Missouri. I'm the youngest in my family. None of my siblings, neither of my siblings, and none of my parents are in medicine. I don't even have a first degree relative that's in medicine, but for whatever reason, at an early age, I sort of just always liked understanding how things worked. I would like watching shows about just how things are created, how things are made. And when I was in high school and I think it was in ninth grade when I took biology, I sort of instantly fell in love with that aspect. I always liked how things work, and then taking that same theory and applying it to the human body just really resonated with me. After high school, I attended the University of Pennsylvania in Philadelphia, and I started as pre-med, but I had an open mind, so I wanted to make sure that I was not sort of pigeonholing myself to a specific career path. I took a biology, but I also took literature and history classes, but I always came back to biology. I minored in neuroscience, and my major was a sort of this hybrid of psychology and neuroscience called the biologic basis of behavior. After completing Penn, I attended the Albert Einstein College of Medicine. I did 5 years of med school, so that included a year of dedicated research. And when I was doing my rotations during my third year, I had no idea what urology was. I don't even know that I knew a urologist growing up, and I had no idea what urology as a field was. But I knew that I liked surgery. And during my rotation, during my third year clinical rotation, but what I definitely knew I didn't like about surgery is you're totally missing a patient relationship, certainly a patient relationship that can exist over years. My sense of general surgery was that people were referred to you. You would either tell them surgery was appropriate or not appropriate. If it was appropriate, you would do the operation, see them post-operatively, and pretty much not see them again. That was, I think, for me, something that I didn't love about surgery. Someone told me about urology, said during my surgery rotation in third year, I should try it. I did it for a year, and it was just sort of like fell in love with it immediately. It was really the perfect marriage of what I liked about surgery, but also adding components that are not true in general surgery. And that includes having a patient relationship, seeing a patient every 6 months, every year, getting to know them, getting to know their family. But it also included a really nice combination of medicine and surgery. So a lot of the treatments that I give for patients, whether it's for erectile dysfunction, enlarged prostates, is medical management. And not every patient needs a procedure. Not every patient needs a surgery. So to be able to have both medical management as well as surgical management is really, I think, unique to urology. The other thing I like is that there's patients often come in and they may be in distress because they can't urinate. They may be in a lot of pain because they have a kidney stone that's blocking one of their kidneys. And we can do something which to us seems like a 5 or 10 minute procedure. And to them, they are so grateful, so appreciative, and you really see the way in which you're able to impact their life. That also includes women who have recurrent infections or women who have leakage of urine and have to wear pads. You can do something that they may not have even known was an option and completely change their quality of life. And I think that's really gratifying and satisfying as a provider.